Good afternoon, everyone. According to the routine, today's topic is, I think, spinal cord. Okay, so today we'll be completing two topics. Few portions of the eyeball was left. First, I will complete this, and then I will go to the spinal cord. Okay. So, which portion was left in eyeball? Up to retina, we have discussed in the last week. A crystalline lens was left, followed by eyelid. Another important part is left, that is conjunctiva. So today I am not going to discuss about the conjunctiva. In gross anatomy part, the conjunctiva will be covered. Okay. So first we will be discussing about the microscopic structure of crystalline lens. Okay. I hope you can see the diagram of the lens. Okay. So crystalline lens, first of all, it is transparent, biconvex, and avascular structure. Okay. So it is transparent, it has to be transparent because light will pass through the lens. Okay. Next, it is biconvex, as you can see the shape of the lens, and it is avascular in nature. That means it don't have direct blood supply. Where it is situated, lens, it is situated in between the anterior segment and the posterior segment of the eye. Okay. If you remember this diagram, this is the position of the lens. Okay, so this is the posterior segment and this is the anterior segment. In between both the segments, the lens is situated. Okay, in between the aqueous humor and vitreous humor. Now, in front of the lens, we are having aqueous humor, and behind the lens, this particular part is occupied by vitreous body. Okay, so this is the position of the lens. Next, if you see the crystalline lens, mainly it is made up of protein. 60% of the lens is made up of protein. So any structure in our body doesn't have more than protein than this lens. Okay, जितना भी body structure है, कि उसमें सबसे ज़्यादा protein किस में रहता है? Crystalline lens. Okay. Now, three layers are there in the lens. Okay, first of all, the lens capsule is there. The outermost part is the lens capsule. Okay, next to that you can see the lens epithelium, and deep to that the lens fibers are situated. So these are the three layers which are present in the lens. Okay, so if you go, if you see the outermost aspect, okay, then lens capsule is there. Lens capsule is nothing but the basement membrane of the lens epithelium. Is if any epithelium is there, it will be having basement membrane. Okay, तो जो lens epithelium है उसका basement membrane होता है lens capsule, which you can see over here, followed by the lens epithelium, and then you can see over here the lens fibers. Okay, so this is the arrangement of different structures in the crystalline lens. Now, you have noticed one thing, that on the posterior aspect, this is the anterior aspect of the lens, this is the posterior aspect. Okay, on the posterior aspect you will see that the lens epithelium is absent. I hope you have noticed that in the diagram. ये देखो lens epithelium जो होता है सिर्फ anterior aspect में होता है, up to the equator. Okay, these are the equators of the lens. On the posterior aspect, lens epithelium are absent. Okay, now the question is, why lens epithelium are absent? So from the anterior aspect, okay, when the lens epithelium is proliferating continuously and it is going laterally, okay, the length of the lens epithelium increases. From anterior aspect to lateral aspect, when it is proliferating the cells, the length increases the lens epithelium. Okay, generally it is simple cuboidal epithelium. As it goes towards the equator, the length increases. Okay, and those epithelium only after crossing the equator they becomes the lens fibers. Okay, lens fibers epithelium से ही आता है. Okay, extra कोई cells नहीं है that the lens fibers will be formed. From those epithelial cells which are getting elongated, and then gradually they will form the lens fibers. Once they become a mature lens fiber, the nucleus which is present inside the cell, that is also lost. So they will become a fiber only, lens fiber. Okay, like this the fibers are formed. Okay, here you can see the diagram of gross structure of lens. Okay, where all the parts of the crystalline lens can be seen. Okay, so you can see this is the anterior aspect, this is the posterior aspect. On posterior aspect, as you can see, the lens epithelium is absent. Lens epithelium नहीं रहता है, ठीक है? On the interior aspect, you can see lens epithelium is there. Okay. After that, this is the transitional zone, which is present just near the equator of the lens. These two areas are called as equator of the lens. This part and this part. From here, the fibers are forming. Means the lens epithelium will convert themselves into fiber. Now, if you have noticed the diagram, okay. Now see, these are the fiber. These are the lens epithelium. I hope you can see as it is coming towards the equator, the length increases. See the length over here and see the length over here. Can you see it is the length is more as compared to this part? Okay. So like this, the length increases and then they will become the lens fibers. Okay. Now at the center, you can see these are the primary fibers. Okay. And these are the secondary fibers. Primary fibers, these are the old fibers. Okay, जो already production हो गया है, gradually they will go towards the center. Okay, and they will occupy the center. As you can see, fibers are forming and gradually they will go and occupy the center. It is also present in the center, as you can see. Next, the fibers which are newly forming, these are called as secondary fibers. And in that case, you can see a few of the fibers there having the nucleus. As the length increases, they are becoming the primary fibers. The nucleus is reduced. Okay, nucleus will not be present, as you can see in this particular diagram. Now the capsule is present throughout the lens, on anterior aspect also and on posterior aspect also. Capsule यहाँ भी है, यहाँ भी है. Both the aspect capsules are present. Okay, so lens capsule, as I said, it is nothing but the basement membrane of the lens epithelium. Okay, so it is a transparent, homogeneous, and highly elastic collagenous basement membrane. Okay, so it is homogeneous along with that highly elastic and collagenous basement membrane. Collagenous means it is made up of collagen fibers. Which type of collagen fibers are present? Type 4 collagen fibers are present along with that glycoproteins and laminin. These are also present in this particular layer. Okay. Now it is very thick. Okay. If you see the capsule, it is thicker in front than behind. That means on the anterior aspect the thickness is more. Posterior aspect the thickness is less. And it is produced by the lens epithelium only. And it is the thickest basement membrane. जो lens epithelium होता है, it is the thickest basement membrane of the body. Now the lens capsule is thickest near the equator. Okay. So anterior aspect it is thick. Once it reaches the equator, it is thickest. From there, gradually when it will go posteriorly, the thickness reduces. Once on the posterior aspect, the thickness is very less. Okay. Now there are some age-related changes also. As you can see, thickness of the anterior lens capsule increases with age. Okay, as the age increases, the thickness will also increase. Whereas thickness of the posterior part of the capsule remain constant or changes very slightly. So that is the lens capsule. After that is the lens epithelium. So what is the lens epithelium? Which epithelium is present in the lens? Simple cuboidal epithelium. जो लेंस epithelium है उसमें कौन सा epithelium रहता है? Simple cuboidal epithelium. Okay. So deep to the capsule, as you can see, it is covered on its anterior surface only by a lens epithelium. That means the lens epithelium is present on anterior aspect only. On posteriorly, it is absent. Lens epithelium is not there. Which type of cells are present? As you can see, these are cuboidal cells. However, when you go towards the periphery, okay, from the anterior aspect, when you go towards the periphery, the cell will become longer. Ultimately, they are converted into lens fiber. Okay, so from epithelium only, the lens fibers are formed. Now, if you see the cells, they are highly active, metabolically active. They contain sodium ion, potassium ion, ATPase. Okay, why these are present? Because they have to produce the ATP to meet the demand of the lens cells. That's why the cells are very active, metabolically active. The lens epithelium continue to divide and develop into the lens fibers. Okay. Now here you can see there are no posterior lens epithelium, as I have mentioned earlier. जो posterior aspect होता है उसमें lens epithelium नहीं रहता है. Why it is not there? Because cells originally located there are elongated into primary fibers. Okay, so the cells, when it goes on the posterior aspect, what will happen? The length will increase, and from cell they will become fiber. Okay, and when they are becoming older fibers, as I said, the nucleus will be lost. In that case, they don't have any nucleus. Okay, so that is the lens epithelium. Now what is the next? Three things are there. First is the capsule, epithelium, then lens fibers. Next is the lens fibers. So as I said, lens fibers, from where they are developing? They are developing from the epithelial cells only. Okay, so how they will develop? They will elongate. First of all, when they reaches the equator, at that time a transition zone is there where the length of the cell increases, and gradually they will become the lens fiber. Now when the lens fibers are formed, if you see, mainly it is made up of a special type of protein that is called as crystalline. The lens fibers, they are made up of a special type of protein that is called as crystalline. Okay. Next, if you see the lens fibers, they are how they are arranged. They are arranged in laminated structure. Laminated structure का मतलब क्या है? What is the meaning of laminated structure? One over another. Okay, because continuously lens fibers are forming from the lens epithelium. That's why when you will see the fibers, how they are arranged, laminated pattern. Okay, means layer wise. So laminated structure of the lens due to continuous addition of fibers, okay, in the equator region throughout the life. That's why the laminated pattern of the lens fibers can be seen. Okay. So if anyone asks you how the fibers are arranged in case of lens, crystalline lens, they are laminated form. Okay. Now another important point, that is, if you see the fibers, okay, at the center, the fibers which are present, okay, those are called as nucleus, okay, and which are present at the periphery, these are called as cortex. Why? Because the central part become harder. Why it is harder? Because as I said, the fibers, they will lost the nucleus, okay, and only fiber is present. That's why the center part of the lens is harder, and it is called as nucleus. And the peripheral part is softer, because in the peripheral part, the cellular organelles, the nucleus is still present. Okay. Now in this diagram you can see this particular part is the nucleus, and this particular part is the cortex. Okay, so जो cortex वाला part है, this will be soft, and if you see the nucleus, it is harder, because in the nucleus only fibers are present. Okay, here along with the fibers, though elongation is taking place, they are newly formed fibers plus cellular organelle nucleus are present inside the cell. Okay. Next, there are some important features related to the fibers. First of all, the nucleated and non-nucleated lens fibers. So which is nucleated, which is non-nucleated, I have shown you. जो न्यूक्लियस होता है सेंटर में, ठीक है, वहाँ पे जो फाइबर्स होगा, those are non-nucleated. Okay, and the periphery, the fibers which are present, those will be nucleated. So first of all, in those both the type of fibers, crystalline proteins are present. Next, in the absence of, this is very important, in the absence of nuclei, how the protein synthesis will take place? It is maintained by the long-lived mRNA. Okay, so this mRNA is present, and that is continuously forming the protein, which is required for the survival of the lens fibers. Next, when you will take a cross section of those fibers, it is hexagonal prism. The shape is hexagonal prism. Next, have you heard there is a instrument, okay, that is called street lamp. I don't know whether you have heard or not. I'll give you a, let me give you a demonstration. When you have visited any of the shop where those sunglasses are there. Okay, at that time you have seen how they used to check the power of the eye. Okay, how to determine what is your power. Okay, now another machine is there, not in all the shops, but in few shop one machine is there where they will ask you to put your mouth like this. Okay, and from the opposite side they will see through your eyes. I hope you have seen that machine. It is called street lamp. Okay, so through that slit lamp, the lens can be seen. So if you see the fibers through that slit lamp, okay, then what you can see, okay, that is very important, because you can see the lens fibers. Now directly, in order to see the arrangement of the fibers, you can't take out the lens of a person, right? अगर मान लो किसी का lens में problem हुआ है, you can't take out the lens. So how you will see the fibers of the lens? Through that slit lamp. Okay. Here I have not added the image. Okay. Next time I will add the image so that you can see how it appears, the slit lamp. So through that slit lamp, you can see the lens fibers. Okay. Now when you will see the lens fibers in the lens of fetus and lens of adult, okay, it is different. Okay, the arrangement of the fibers are different. In case of adult, it becomes very complicated. Now, when the lens is examined from front or from behind, okay, three faint lines can be seen radiating from the center to the periphery. Okay, that means if you see the lens from anterior aspect or if you see the lens from the posterior aspect, what you will see, three faint lines radiating from the center to the periphery. Now, in case of fetus, these lines form Y-shaped structure. Okay, upright on the front of the lens and inverted at the back. That means when you will see in case of fetus, the Y-shaped structure which is formed will be normal Y from anterior aspect. If you see the same thing from the posterior aspect, it will be inverted Y shape. Okay, that indicates the arrangement of the fibers in case of fetus. Next, in case of the fibers in case of adult, what happens? As you can see, multiple branches, 6 to 9 or 9 to 15 branches are seen, and that also in dendritic pattern. Okay, so this is the complication, or you can say complex arrangement of the fibers in case of fetus and in case of adult. Okay. So this complex arrangement which you can see, okay, these are called as sutural lines, and if you see the sutural lines, they are made up of amorphous material. Okay. Now each of the fibers starts at one line and follows a curved course to the opposite surface where it ends by joining such line. So this is a very complex arrangement of the sutural lines in the eyeball. Let me show you the diagram here. Here you can see the diagram. Okay, in the diagram, as I hope you can see. So what is this? This you can see in a fetal eye, inverted Y-shaped structure of the lens fibers, especially when you will see from the posterior aspect. Same thing when you will see from the anterior aspect, the inverted Y will become straight only, normal one. Okay. Next, here you can see the other fibers. Okay. Now these are the pattern of arrangement in case of adult. Okay, where the fibers are radiating and having different branches, and the appearance is dendritic in nature. Okay. So next, here you can see this is the schematic diagram of the lens fibers. Okay, so what you can see over here, first of all, you can see this is the subcapsular epithelium. What is the meaning of subcapsular epithelium? That means the lens epithelium. Okay, so if you concentrate over here, this will be the lens capsule. This is the lens capsule. Just deep to the lens capsule, here you can see the lens epithelium. This is the lens epithelium. Okay, so lens epithelium is made up of simple cuboidal epithelium. Okay, next, if you go towards the periphery, then these are the fibers. Okay, Now here you can see these are the newly formed fibers. So in case of newly formed fibers, the nucleus can be seen. Okay. Once the fibers become mature, they will go towards the center. Once the fibers become mature, they will go towards the center. Now if you see the fiber towards the center here, the nucleus are absent. Okay. So identification of the lens under microscopy is not that difficult. It's very simple. Okay. So in diagram in your history notebook, you have to draw this diagram. This is not required. Okay, this is not required. Just draw this one. And here you can see all the parts of the lens which we have discussed earlier. Okay, next is the eyelid. So these are the folds of skin, okay, which are protecting the eyeball, helps in closing the eye. Okay, and another important function, it used to keep the cornea moist. Okay, this is also a very important function. It helps in keeping the cornea moist, because we know that cornea is avascular structure. It don't have any blood supply. Okay. Next, if you see the eyelids, the layers from external to internal, total 5 layers are there. What are they? First is the skin. Okay, as you can see in the diagram, first is the skin. Now deep to the skin, you can see subcutaneous connective tissue is present. After that, the muscle layer. Now which muscle is present? Orbicularis oculi. That also palpebral part of the orbicularis oculi muscle. Okay, in the face region, we have discussed about the muscles. Okay, so here you can see the orbicularis oculi muscle. These are the cut section of the orbicularis oculi muscle. Then very important structure, that is the tarsal plate. This is the tarsal plate. Okay, which is forming the main skeleton of the eyelid. दोनों eyelid में रहता है, upper eyelid में भी रहता है, lower eyelid में भी रहता है, tarsal plate. Okay, and in the tarsal plate only different types of glands are present. They are also called as meibomian gland. Next, the innermost layer is the palpebral conjunctiva. Okay, तो जो conjunctiva होता है 3 layers रहता है conjunctiva का, और you can say 3 parts are there. So the innermost part is the palpebral conjunctiva. Then here is the bulbar conjunctiva. In between them, we are getting the fornices of the conjunctiva. So today we are not going to discuss about the conjunctiva, but please keep that in mind. Conjunctiva, the palpebral conjunctiva is attached, okay, or is present in the innermost layer of the eyelid. Okay. So this diagram is important. You have to draw this diagram also. So this is the outermost part. This is the innermost part. Okay. This is the outermost part. This is the innermost part. So outermost part में क्या रहेगा? First of all, skin. This is the eyelid, right? Everyone, you can feel this is the eyelid. So the skin part जो बाहर से दिखाई देता है, if you close your one eye, okay, जो बाहर से दिखाई देगा, okay, that is this particular part. You are looking from here. Okay. Next, if you can do one thing, just retract your eyelid. ऐसे ऐसे करो. जो अंदर वाला दिखाई देगा, that is the palpebral conjunctiva. Okay, and it is present on both the eyelid. ऊपर में भी रहता है, नीचे में भी रहता है. Okay, so and in between this, all the layers are present. Okay, so I hope you have understood in case of eyelid, which is the outermost layer and which is the innermost layer. In between all the layers, whatever I have mentioned, those layers are present. Now there is a difference in case of upper eyelid and lower eyelid. Okay, what is the difference? If it is upper eyelid, then here you will be getting an additional, that is the levator palpebrae superioris muscle. ये देखो, levator palpebrae superioris muscle, जो lower eyelid में नहीं रहता है. Okay, now why it is present in upper eyelid? Why it is not present in lower eyelid? Because levator का मतलब क्या है? What is the meaning of levator? Levate का मतलब क्या करेगा? What it will do? It will elevate. You have studied about levator scapulae. So what is the function? हाँ, तो here levator palpebrae superioris मतलब क्या है? It will elevate. So whenever we are closing our eye, at that time which muscle is acting? Orbicularis oculi. Okay, whenever we are closing our eye, at that time which muscle is acting? Orbicularis oculi muscle. Next, whenever we are opening our eye, at that time which muscle is acting? It is the levator palpebral superioris muscle. Okay, what it will do, it will elevate the upper eyelid. तो जब हम लोग आईज को ओपन करते हैं, दैट टाइम क्या होता है? जस्ट स्टैंड इन फ्रंट ऑफ मिरर एंड वॉच. जो अपर आईलिड होता है वो एलिवेट होता है, ठीक है, ऊपर जाता है. तो हाउ इट इज टेकिंग प्लेस? बिकॉज ऑफ द प्रेजेंस ऑफ दिस मसल, levator palpebral superioris muscle. Okay, so though it is not required in the lower eyelid, that's why lower eyelid में नहीं रहता है. Okay, and it is present in the upper eyelid. That is the difference. So everyone please don't forget to draw this diagram. ठीक है, this diagram is important, you have to draw. Though it is not a microscopic structure, still you have to draw it. So if you see the skin, first of all it is very thin. Okay, it is very thin. Small hair follicles are there, and if hair follicles are present, that means what will be there along with the hair follicles? Sweat glands are also present. Okay, next, deep to the skin delicate connective tissue is present where fat is absent. Now, there are some areas in our body where the superficial tissue, okay, the delicate connective tissue where fat is absent. So eyelid is an area, okay, where just deep to the skin fat is absent. Okay, you can't see fat. Next, the considerable thickness of the eyelid is formed by the fasciculi of palpebral part of the orbicularis oculi muscle. Okay, so most of the thickness is made up of two parts. Okay, that is the orbicularis oculi muscle and the tarsal plate. Orbicularis oculi muscle is very important because it helps in the closing of the eyeball. Next, the skeleton, main skeleton is made up of mass of a fibrous tissue that is called as tarsal plate. Just now I have shown you. Okay, now on the deep surface of the tarsal plate you can see a series of vertical grooves are present. Okay, and on those grooves the tarsal glands are present. Okay, so deep surface of the tarsal plate, a series of vertical grooves are there, and on those vertical grooves tarsal glands are present, and those tarsal glands are also called as meibomian glands. Okay, anyone have you heard about stye? S-T-Y-E, stye. Hordeolum. I hope you have seen sometime the upper eyelid. Okay, boil type structure is present in the upper eyelid along with swelling. Okay, and the area becomes red. Very common condition. Okay, तो उसमें क्या होता है? Mainly it is a bacterial infection. In this case, the secretions which are coming out from the meibomian gland, those are blocked. As a result, the swelling is taking place. Okay. Next, so on the tarsal plate, what glands we are getting? Tarsal glands, or also called as meibomian gland. Next, these particular glands are very important. Okay, now why these glands are important? Because इसका जो secretion होता है, that is oily in nature, and that secretion prevents the evaporation of the corneal fluid. Okay, means it delays the evaporation of the fluid, so that cornea will not get dried up easily. Okay, so the tarsal glands, these are the modified sebaceous gland. They produce oily secretion. Okay, and a thin film which spread over the lacrimal fluid. Okay, in the conjunctival sac and delays the evaporation. This is very important function of the tarsal glands. Next, other types of glands are also present in the eyelid. Okay, now what are these? Some modified sweat glands are there. These are called as ciliary glands, or also called as glands of Moll. Okay, present near the margin of the eyelid. Okay, a free edge of the eyelid. Next, there are some glands which are related to the eyelashes. Okay, these are called as glands of Zeiss. Okay, जो eyelashes होता है, these are the eyelashes. Okay, So some glands are present in association with the eyelashes. These are called as glands of Zeiss. And some accessory lacrimal glands are also present. Okay, just above the tarsal plate. These are called as glands of Wolfram. Okay, and in case of upper eyelid, what is present? Levator palpebralis superioris muscle is present in case of upper eyelid. Okay. Next, the innermost surface or innermost part of the eyelid is lined by palpebral conjunctiva. Okay. Now, in case of palpebral conjunctiva, we are getting stratified squamous non-keratinized epithelium. Along with that, goblet cells are present. Okay, and it is resting in the lamina propria. Here you can see the layers of the eyelid. So which is the external layer and which is the internal layer, means which is the outermost layer and which is the innermost layer. Which side is innermost? This is which side? Outermost, and this is innermost. Why you have said that this is outermost layer? Because skin is present. Okay, you can see the epidermis, you can see the dermis and epidermis. These are the part of skin. Okay, if you concentrate over here, you can see epidermis and dermis. These are the part of skin. Okay, that means this is the outermost layer. And along with that, can you see the hair follicle? Though it is a true skin, though hair follicles will be present, as you can see. Okay, so this will be the outermost layer and this will be the innermost layer. Okay, now in between this, can you see all the layers? So this is the skin. This entire part is made up of skin. Then here you will be getting the delicate connective tissue. Okay, after that, here this is the muscle layer, which is made up of orbicularis oculi muscle. ये पूरा part orbicularis oculi muscle. Next, here you can see this is the tarsal plate where different types of glands are present. Okay, so see meibomian glands are there. Then here you can see along with the eyelashes, glands of Zeiss are there. Okay, so like this different glands are present. And then the innermost layer, this is the palpebral conjunctiva. Okay, तो जो palpebral conjunctiva होता है, that is stratified squamous non-keratinized epithelium. Okay, so these are the layers of the eyelid. So in eyelid, you have to draw two diagrams. This is one diagram and the first one which I have shown you already. Okay, so only these two structures from eyeball. Next structure is spinal cord. Microscopic structure of spinal cord is very easy. It's not that simple. Okay, the gross structure of spinal cord is very difficult, very complicated. What you have studied in spinal cord? In physiology, I know you have studied about the spinal cord. Physiology, spinal cord. So everyone, you know that spinal cord is a part of central nervous system, elongated part of central nervous system. The medulla oblongata extend downwards. Okay, from where to where it is extending? Upper border of the C1 to lower border of the L1 vertebra. Okay, that is the extent of the spinal cord, and it is occupying the upper two-thirds of the vertebral column. The spinal cord, it is occupying the upper two-thirds. If you see the spinal cord, how it is, what is the appearance of the spinal cord? Cylindrical shaped. जो spinal cord होता है उसका appearance कैसा होता है? Cylindrical shaped. Okay. Next, there are some important features of the spinal cord. Okay, for example, if you see the terminal part of the spinal cord, it is conical and it is called as conus medullaris. It is called as conus medullaris, the terminal part. Next, from the terminal part, a thread-like structure is extending downwards, which is nothing but a modification of the process of the pia mater, and that is called as phylum terminale. Okay. And though it is a part of central nervous system, so it is surrounded by meninges. Okay, that means all the layers of meninges are present in the spinal cord. Next, in order to do the study, okay, so as I have mentioned, what is the shape of the spinal cord? कैसा दिखता है? Cylindrical. Okay, that means what we have to do, we have to take the TS. Cylindrical structure, we will be taking the TS and then we will do the study, internal study. Okay, So first we have to take the TS. Once we take the TS, then what you can see inside the spinal cord, it is made up of two parts. Outer part is made up of white matter and inner part is made up of grey matter. तो white matter में क्या है, grey matter में क्या है, that only we have to know. Okay. Now please keep that in mind. ये जो spinal cord का cross section है, in different levels it is different. For example, in cervical level, if you see the appearance, it will be different. In thoracic it is different, lumbar it is different. Even in sacrum or sacral region also it is different. Okay. So those will be discussed in gross anatomy part. And now in general, if we take a TS, what we can see, that we will discuss. Now here you can see this is the cross section of the spinal cord. Here I have not mentioned at which level we have taken the TS. Okay, that will be discussed later on. In general, if you take the TS, this will be the appearance. Okay. So it is made up of what? It is made up of two things. The inner part is called as grey matter, outer part is called as white matter. तो grey matter में क्या रहता है? What? Unmyelinated? No. Anyone, what is present in the grey matter? Yes. Bolo. Cell bodies of the different neurons are present. Okay, cell bodies of the different neurons are present in the grey matter, central grey matter. Okay, and if you see the periphery, okay, the peripheral part, it is made up of white matter. White matter में क्या रहता है? Nerve fibers. ठीक है, so don't get confused. जो nerve fibers होता है वो periphery में रहता है, और जो central part है, that is you can say edge shaped or butterfly shape, that is made up of what? That is made up of cell bodies. Okay, of different types of neuron. Next, तो जो central part होता है, as I said, it is edge shaped or butterfly shaped. Okay, now before going to that, there are some external features of the spinal cord that you have to know, which is seen in this particular section. Now, why it is important? Because you have to know which part is anterior and which part is posterior. So whenever you will be taking a section, okay, you can see a fissure is present, okay, and you can see a sulcus is present. तो जहाँ पे fissure रहेगा, that is anterior aspect. जहाँ पे sulcus रहेगा, that is posterior aspect. So here you can see anteromedian fissure is there, that means this is anterior aspect. This is the posterior median sulcus, that means that is the posterior side. ठीक है? So this is anterior side, that is posterior side. Now at the center of the spinal cord, when you have taken a cross section, ठीक है? After that at the center, can you see a hole can be seen? See the diagram. Center कहाँ पे होगा? In the center, can you see a small circle is white color का? Yes, that is called as central canal. Okay, it is extending throughout the length of the spinal cord. So once you जो canal है, once you take the TS, what will be the appearance? Circular appearance will be there. That's why you can see this is the central canal, circular appearance. इसका function क्या है? CSF flows. Okay, CSF is flowing through this central canal. Okay, production of the CSF is taking place in the ventricles. ठीक है, तो from ventricle how it will go into the spinal cord, various part of the spinal cord through the central canal. Okay, तो central canal का मतलब ये central का मतलब क्या है? Center में है. ठीक है. Next, this is the grey matter. Now the grey matter, as I said, it is edge shaped or butterfly shaped. Okay, so it is also having various parts. Mainly two parts are there. Okay, that is anterior horn and posterior horn, are also called as ventral horn and dorsal horn. Okay, so which will be the ventral horn? Which side is anterior over here? Yeah, this side is anterior, that side is posterior. So ventral horn कौन सा होगा? तो this is the ventral horn and this is the dorsal horn. Okay, another important way to identify the ventral and dorsal horn, if you see the ventral horn, it is broader, broad होता है. Okay, and it is shorter. But if you see the dorsal horn, it is narrow and it is longer. Okay, can you see in the diagram? So this is the dorsal horn. The dorsal horn, you can see it is longer and it is narrower. And in case of ventral horn, it is shorter and it is broader. In between both the horn, in some section or some part of the spinal cord, another horn is there that is called as lateral horn. Okay, as you can, these are the lateral horn. Everywhere it is not present. In some areas of the spinal cord, lateral horn is present. Some areas it is absent. Okay. So this is the central gray matter. Okay. Now in the gross anatomy we will discuss that in central gray matter only, in anterior horn, lateral horn and in posterior horn, different cell bodies of the neurons are present. Okay, they are arranged in different groups. Okay. And next, if you come over here, okay, if you come over here, what is this? ये क्या है? ये पूरा part, peripheral part क्या है ये? This is the white matter. White matter doesn't mean that it will look completely white. ठीक है? तो this particular part is completely made up of white matter. Okay? तो white matter में क्या रहता है? Fibers रहता है. In physiology, I know that you have studied about the tracts of the spinal cord, ascending tracts, descending tracts. तो जो जितना भी tracts कहाँ पे रहता है? यहाँ पे, ये पे रहता है. Okay? So these are the areas where those fibers are present. Okay, now in gray matter, first of all, what is present in the gray matter? It consists of nerve cells, okay, neuroglia and blood vessels, and arranged in H-shaped column. Okay, so along with the nerve cell bodies, other types of cells are also there. Those are called neuroglia cells, glial cells of the supporting cells, and blood vessels are also present. That means whenever you will be taking a section, you can get some blood vessels. Okay. Next, the gray matter present a pair of lateral anterior ventral gray column called as ventral horn. So I have shown you the ventral horn and I have shown you the dorsal horn also. Okay. Next, there is a intermediate region. Okay, intermediate area. An intermediate area intervenes between the anterior and posterior horn, and gray commissure connects the symmetrical half. Okay, so there is an area that is called gray commissure. Now this gray commissure, what it will do, it will interconnect, because two sides are there, right half and left half. So both the halves of the spinal cord of that particular section are interconnected to each other by this gray commissure. Okay, here you can see the gray commissure. See, this is the gray commissure. यहाँ पे रहता है around the central canal. Okay, it is a mass of gray matter. Okay, so this is the central canal. Around the central canal, gray commissure is present. Now this gray commissure, what it will do? It will interconnect the gray matter of both the sides. Okay, right side and left side. That is the gray commissure. The gray commissure, already I have told you, that is a strip of gray matter surrounds the central canal of the spinal cord along with the anterior white commissure and connects the two halves of the spinal cord. Okay, and it is traversed by central canal. Okay, central canal is. Now there is a very important point. If you see the central canal, as I said, what is the function? Through central canal, CSF is flowing. Now the central canal is lined by ependymal cells, or you can say ependyma. Have you heard about this ependyma or ependymal cells? I know you studied in physiology. Okay, so these are nothing but the simple columnar, ciliated simple columnar epithelium. जो ependyma होता है, central canal होता है. Though inside the central canal, ependymal cells are there. Okay, now ependymal cells are which type of epithelium? Simple columnar epithelium, that is also ciliated simple columnar epithelium. Okay, next, if you see the central canal within the conus medullaris, the central canal is enlarged to form the terminal ventricle. Okay, because here the spinal cord terminates, so the size of the central canal enlarges, okay, to form a ventricle that is called as terminal ventricle. Now the central canal divides the gray commissure into ventral and dorsal part. Just now I have shown you. Okay. Now the central bodies of the nerve fibers, okay, are present, and prominent nisal substance are present in this region. Okay. I hope you know what is the nisal granules. Nisal substance are also called as nisal granules. They are more in this particular area. Now this is the diagram showing the different types of nerve cell bodies, okay, present in the different areas of gray matter. Okay, so this is the gray matter. So here only one half of the gray matter is shown. Okay, now why I have shown you this diagram? During the time of exam I know time is limited, so whenever you are drawing any diagram it takes time. Okay, so in case of spinal cord, what you can do, the cut section, though right hand and left half are similar, okay, that's why you can draw only one half. दोनों हाफ ड्रॉ करने का जरूरत नहीं है. Okay, you can draw only one half to show the parts. So here you can see only one half is shown. Okay, in this particular half, which is the ventral horn and which is the dorsal horn? Which horn is this? This is ventral horn. Okay, this is the dorsal horn, this is the lateral horn. Okay, now here you can see different types of nuclei which are present. Okay, these are the cell bodies of the different neurons are present in this H-shaped gray matter. Okay. Now in white matter, what is present? Myelinated nerve fibers, along with that blood vessels and neuroglial cells are present in the white matter. Okay, so white matter is present along with the H-shaped or sir. Okay, so if you see the white matter, it is present surrounding the H-shaped gray matter. तो जो H-shaped gray matter है, along with that or surrounding that, on at the periphery the white matter is present. Okay, तो white matter में क्या रहता है? As you can see, the nerve fibers are covered by a fine connective tissue covering that is called as epithelium. Okay, that can also be seen under H&E section. Next, under H&E section, the myelin sheath is removed. Now this is very important during the tissue processing, hence the axons are surrounded by clear space. Though the myelin sheath are removed, that's why around the axon you can see some clear space. Okay, in H&E staining. Another important part is in the spinal cord, the white matter, the area is divided into three parts. Okay, and these are called as white columns or funiculi. Okay, white columns or funiculi. Three different white columns are there: anterior, lateral and posterior white column. तो anterior white column कहाँ पे रहता है? Between the anterior median fissure and anterior horn. That is the anterior white column. Lateral between the anterior and posterior horn, and the posterior white column between the posterior median septum and posterior horn. These are the areas of the white matter. Now, why these areas are defined? Wait, let me show you the diagram. Yeah. Now, here you can see that the white matter. तो white matter कहाँ पे है? ये देखो, ये पूरा white matter है, ठीक है? Now, this white matter is divided into three columns, or they are called as funiculus. Okay. This is the anterior funiculus, this is the lateral funiculus, and this is the posterior funiculus or posterior column. Okay, anterior one is present. So this is the anterior horn. In between the anterior horn and the anterior median septum, this is the anterior funiculus or anterior white column. Okay. Next, this is the posterior white column in between the posterior median sulcus and the dorsal horn. दोनों के बीच में जो रहता है, this particular part of the white matter is called posterior white column. Okay, and in between the anterior horn and the posterior horn, this particular area is called as lateral white column. ठीक है, दोनों साइड में तीन कॉलम रहता है. Now the question is why? क्योंकि completely made of white matter, मतलब fibers रहता है. Then why it is divided into columns? because in each and every column particular, or you can say specific type of nerve fibers are present. Okay, and that you have studied in tracts. तो in tracts what you have studied, अगर मान लो कोई ascending tracts है, तो what you have studied, what are the points? First of all, you have to know what is the origin of the tract. Okay, and I'm talking about ascending tracts. What is the origin of the tract? Then when the tract is passing through the spinal cord, through which white column they are passing, either from anterior, lateral or posterior, through which white column they are passing. Okay, it will be specific. I don't know whether you have studied this or not. If you have not studied, you have to study this. Okay, and then where it is reaching, and then what are the different types of sensation carried by the tracts. These are the points that must be there whenever you are studying about any of the tract. Same descending may be same hota hai. When it is descending, through which part of the white column it is passing. Okay, so that's why it is divided into 3 different types of column, white column. Anterior white column, lateral white column, and posterior white column, are also called as funiculus. Okay. Next, the white matter of right and left half, both sides of the spinal cord are continuous across the midline through the ventral white commissure. Okay, so this commissure, what it will do, it will interconnect the fibers of both the side of the spinal cord. Okay, so 2 halves are there, right half and left half. Both the halves of the spinal cords are interconnected to each other by ventral white commissure. कहाँ पे रहता है? Which lies anterior to the grey commissure. जो ग्रे कमीशर है, ग्रे कमीशर का एंटीरियरली रहता है, दैट इज द वेंट्रल व्हाइट कमीशर. ओके, नाउ इन व्हाइट मैटर, एज यू कैन सी, ascending or descending tracts that connect gray matter different levels of the spinal cord. This already you have studied. Okay, so in case of histology of the spinal cord, what you have to see, first of all, in the spinal cord, gray matter and white matter is there. Gray matter H-shaped, centrally placed. Okay, what you can see in the gray matter, 2 horns are seen. What are those 2 horns? Mainly anterior horn and posterior horn. Okay, how to identify anterior horn, posterior horn, that we have discussed. Okay, next, if you see microscopically, जो anterior horn है, here you can get large multipolar neurons and very few neuroglia are present. And on the posterior horn, you will be getting small neurons. Okay, and this can be seen under high magnification. Okay, next, white matter में क्या दिखाई देगा? 3 columns are there, where anterior, lateral and posterior columns are myelinated nerve fibers, and along with that neuroglia are present. Now, can anyone tell me what will be the staining differences? Okay, I am coming to the staining difference. Another important thing which you can see under microscope is, you can see the ventral median fissure and dorsal median sulcus, that can also be seen. तो यहाँ पे जो मैंने क्रॉस सेक्शन दिखाया था, okay, that you have seen clearly and labelings are given. Just imagine same thing you are looking under microscope. That means you have to know the difference between the sulcus and you have to know the difference between the fissure, or else identify नहीं होगा. Okay, so that you have to see, you have to identify. Okay, and along with that, you will go to the center, and on the center what you will get? Central canal, that is also seen. Okay, now tell me one thing, जो grey matter है and white matter है, what will be the staining differences? What will be the staining difference under H&E staining? appearance कैसे होगा? or else how will I identify? नहीं तो identification नहीं होगा. Which will be lightly stained, which will be darkly stained? सोचो, think. जो ग्रे मैटर है और वाइट मैटर है, दोनों में से कौन सा डार्कली स्टेन होगा, कौन सा पेल स्टेन होगा? Very easy question, very easy question. Think. Can you identify the central gray matter? Can you identify the white matter? कैसे identify किया? हाँ, तो कौन सा पार्ट डायरेक्टली स्टेन है? हाँ, तो दैट्स व्हाट आई वाज आस्किंग. Okay, because under microscope you can't see entire dorsal horn, you can't see entire anterior horn, पूरा दिखाई नहीं देता है. Okay, तो you have to focus कौन सा एरिया डार्कली स्टेन है, कौन सा एरिया लाइटली स्टेन है. Based on that easily it can be identified. Okay, next what you have to identify? First you have to identify the anterior median fissure and posterior median sulcus. ठीक है, जो फिशर है उसका डेप्थ ज़्यादा होता है, जो सल्कस है उसका डेप्थ कम होता है. ओके, दैट कैन यू सी इन द डायग्राम. ठीक है, तो वो इजीली आइडेंटिफाई हो जाता है. जो इंटीरियर में देखना एक बड़ा सा ऐसे डेप्थ होगा फिशर का. ओके, दैट कैन बी आइडेंटिफाइड इजीली. नेक्स्ट व्हाट यू हैव टू आइडेंटिफाई? सेंट्रल कैनाल. कैन यू सी द सेंट्रल कैनाल? यस. ठीक है, तो एक बार सेंट्रल कैनाल आइडेंटिफाई हो गया. नेक्स्ट यू हैव टू गो ऑन आइदर साइड. सेंट्रल कैनाल मतलब सेंटर में है. From central canal you will go on the right side and left side also. Okay, क्या देखना है? To see the H-shaped gray matter. Okay, as you can see the H-shaped gray matter. तो central canal से दोनों साइड में जाना है. Okay, तो gray matter में what you can expect? Cell bodies of the different types of neurons, and along with that you can see neuroglia cells also and some blood vessels. ठीक है. Next, if you come on the peripheral part, white matter में क्या दिखाई देगा? Nerve fibers will be there. ठीक है. Now, in between the nerve fibers, can you see some empty spaces? Can you see so many empty spaces are there? Empty spaces नहीं रहना चाहिए. Then why empty spaces are present? Yes, because when we are processing the slide at that time, the myelin sheath is removed. Myelin sheath remove हो गया है. So that's why that particular part is empty. कुछ नहीं है वहाँ पे. That's why empty spaces can be seen in between the nerve fibers. Okay, that is a important identifying feature. Okay, so this is the schematic diagram. ठीक है, this is the schematic diagram which you have to draw in your practical notebook. So this is histological diagram of spinal cord. लो मैग्निफिकेशन एंड दिस इज हाई मैग्निफिकेशन. तो क्या दिखाई दे रहा है लो मैग्निफिकेशन में? व्हाट यू कैन सी अंडर लो मैग्निफिकेशन? यू कैन सी बोथ ग्रे मैटर ऑल्सो, यू कैन सी वाइट मैटर ऑल्सो, दोनों दिखाई दे रहा है. राइट. नेक्स्ट यू कैन सी द सेंट्रल कैनाल. ओके, यू कैन सी द सेंट्रल कैनाल. यू कैन इजीली आइडेंटिफाई द स्टेनिंग डिफरेंस. राइट. Next, if you concentrate on the high magnification, what you can see? You can see the types of neuron. Okay, you can see the types of neuron. You can see the gray matter, you can see the white matter also easily. Okay, so if you concentrate over here, okay, you can see the gray matter. In the gray matter, you can see these are the cell bodies. Okay, so here you can see the multipolar neurons. तो multipolar neurons कहाँ पे रहता है? Mainly यहाँ पे रहता है. ओके, एंटीरियर ग्रे हॉर्न और इन द वेंट्रल हॉर्न यहाँ पे क्या रहता है? मल्टीपुलर न्यूरॉन्स आर देयर, लार्ज मल्टीपुलर न्यूरॉन्स. ओके, तो दैट कैन बी सीन अंडर हाई मैग्निफिकेशन. ओके, तो डोंट वरी, इन एग्जाम एज आई सेड नो क्वेश्चंस विल बी आस्क्ड अंडर हाई मैग्निफिकेशन. अंडर लो मैग्निफिकेशन ओनली आइडेंटिफिकेशन शुड बी डन. ओके, तो वट एवर यू सी द अपीयरेंस विल बी लाइक दिस. ठीक है. नाउ here the question may be asked, identify which is anterior horn, which is posterior horn. Okay, यहाँ से question आ सकता है. That you have to identify and easily it can be identified. For that the best way is you have to identify the fissure and you have to identify the sulcus. Okay, so that's all about the spinal cord. So in spinal cord which diagram you have to draw? This one, only this one. ठीक है, और जो पहले था वो ड्रॉ नहीं करना है. ओके, ओनली दिस वन. ओके, सो आई एम हैविंग 2 slides of spinal cord. Okay, let me show you those 2 slides. Let me see whether you can identify or not.